those questions. When should someone consider HRT, Dr. Mary, and what are the risks and who should avoid it? I know you touched on a few, but are there any more specific things you would like to say to answer that question?
Yeah, absolutely. This is a fabulous question. I get it all the time. So it's a deep topic. I'll do my best to really keep it concise, but I'm gonna go in a little bit because it's so important. And there's a lot of misinformation. So let's start with the first question. When should I consider HRT? The old idea was that, and many docs will still say this, is that you shouldn't start till you're postmenopausal. This is absolutely not true, and actually it's the wrong approach if you really want to preserve your health and avoid damage and preserve your sanity if you have symptoms. You can, and it is best to start HRT well before menopause if your hormones are low, regardless of whether you're symptomatic. Test with blood work, as I said, and if you're falling low, it's best to replace and or support your hormones naturally. You don't necessarily want to wait until you have symptoms. Like anything that's off in your body, if something is going wrong, by the time you feel it, that's your body sort of crying out for help, which manifests as symptoms because things are starting to go wrong and damage is being done. If you do have symptoms, you want to explore first, maybe also whether you have lifestyle factors that are contributing to them and harming your hormone production, things your body doesn't like doing. That's sort of 8 things I just rattled off. Then if you still have symptoms, you want to do some hormone testing and look at your levels with your doctor. Hopefully you've already done some testing so you know what your baselines were previously, but if you haven't, that is totally okay too. So in a nutshell, hormone therapy can be certainly very useful at all stages of perimenopause, from early to late. In the early stages, many women would benefit from a low dose of progesterone for disrupted sleep, anxiety, moods, fatigue, and that stuff, etc. I'm just starting this journey myself at 43, just picked up my prescription. I'm stoked to get my sleep on track. That was definitely the first thing for me. Some women will want a little bit of estrogen a little bit earlier on too, depending on their levels and symptoms. So as we progress deeper into menopause towards perimenopause towards menopause, adding estrogen and sometimes testosterone and or DHEA is also important. So I wanted to mention here as well that there are a few more specific intense symptoms or situations that even conventional doctors will recognize as use cases for starting hormone replacement. They are significant hot flashes and night sweats, and those symptoms such as dryness, itching, or painful sex. Signs that you're trending towards osteoporosis. So maybe you have a bone density scan and it shows some loss, or you're prone to brittle bones, breakages, or osteoporosis runs in your family. Estrogen deficiency, which is actually a decrease in estrogen before perimenopause, as in primary ovarian insufficiency or loss of ovarian function before 40, can happen in women genetically, a low percentage of women, but also if you've been really sick, or early menopause, as in women who've stopped having periods before age 45, or who had their ovaries surgically removed before 45. Okay, so hope that is clear on the when. The second part of the question, are there risks and who should avoid hormone replacement? So this is a great question. It's probably going to come up with your doctor because there's a lot of debate around this. And sadly, the whole medical paradigm as it is still being taught is based on seriously flawed research from over 20 years ago in 2021 that indicated an increased risk of cancer with estrogen-only therapy. Now, we would not do estrogen-only therapy. So, duh. And in the study, they didn't even use bioidentical estrogen in the study. The estrogen that is the same as humans when I say bioidentical. Rather, they gave these women who were all over 60, another problem, a totally different estrogen from pregnant horse urine. Not the same. Terrible science. The study was since retracted. It was found to be totally incorrect, and a lot of data has shown since that HRT is so beneficial on a number of levels. But still, that false belief is held by most doctors today, and except in the functional medicine and naturopathic space. And this really just speaks to the fact that Western medicine is on average 14 to 17 years behind the research, and that's why your doctor may warn you off it. So just be aware of that. we now have excellent research showing that HRT is generally very safe and very protective. It has so many proven health benefits, and we now know that providing bioidentical estrogen and progesterone, so the same as the body produces, actually prevents tumorigenesis or the development of cancerous tumors. It represents a strategy to prevent breast cancer, cardiovascular disease, osteoporosis, dementia, Alzheimer's, diabetes, the list goes on. And of course, as we spoke about, the data consistently show that women on HRT can improve their mood, their skin, hair, nails, their sense of vitality, their sexual function, their muscles, bones, libido, and just hugely improve their overall sense of well-being, antidepressive, boosting confidence, that kind of thing. So in fact, I'll point out a stat that the risk of all-cause mortality, aka dying of anything, is reduced by 30% on average in women who are on HRT when it is done well. Okay, that's pretty amazing, right? So you can see a lot of benefit there. As to the who should avoid HRT, there's a raging debate among practitioners, but the consensus from science is that some of the best hormone experts is that basically all women can benefit, but there's a little bit of nuance and certain populations should use caution before starting. It's generally not recommended if you had recent estrogen responsive cancer, such as certain breast cancers or certain uterine cancers. If you have active blood clots, stroke, or heart disease, or undiagnosed vaginal bleeding. You want to get that evaluated first to see why you're bleeding irregularly, as supplemental estrogen might feed a tumor, if that's what is causing the bleeding. However, if you've been clear of those issues for more than 6 months, the latest thinking is that HRT can benefit you and confer protection. So family history of breast cancer or cardiovascular issues is no longer a blanket contraindication. So those are the risk groups. Generally, it's thought that all women can benefit outside of those factors. and for safety's sake, I just want to add a couple of last important notes on what to avoid when it comes to HRT. One, if you're going to do it, it's important to start within 10 years of perimenopause or before age 60 in general to reduce your risk for cancer, which is mild. You're just very mildly increased if you wait for 10 years or longer. Get regular pelvic exams and mammograms. 2, it's very important to take bioidentical hormones, not synthetic ones like progestin, which is different from progesterone and is in a lot of hormone products like the Mirena, the Depo-Provera, and most birth control pills. 3, while estrogen has classically been the prime hormone in HRT, progesterone should be prescribed alongside it in women who still have a uterus because excess estrogen can lead to excess growth of the uterine lining, increasing the risk for endometrial cancer, blood clots, stroke, and breast cancer. So if you have a uterus, you always want to take progesterone and estrogen once your estrogen drops later in the game and you're looking to replace it. 4, always monitor how your body is metabolizing the hormones you're taking by doing a comprehensive hormone test like the Dutch after a few months of starting. You want to make sure you're not breaking down those hormones into harmful or cancer-promoting compounds inside your body. And 5, it's important to make sure you work with a practitioner who knows what they're doing. HRT done badly can be harmful and can increase your risks. Okay. That was a long answer, but I felt like a lot of people wanted to know about HRT. So that was some of it in a nutshell. Back to you, AJ.
Yeah, we have another HRT question. I think this one's a little easier. Do women need to be on hormone replacement therapy for the rest of their lives, or is it a limited time? How does that look?
For sex hormones, generally, yes. It's not the answer women want to hear, but it makes sense when you think about the fact that we live way longer than nature intended these days. Our ovaries just start to shut down and we no longer have the ability to reproduce the hormones at levels that will keep us healthy.
Right. That makes sense. And then another question was, can you comment on the long-term effects of HRT, which I think you touched on a few of them. And what can we expect to change about our treatment later in life? So that kind of ties back into the question we just asked. It's like, okay, yes, we need to stay on it for a long period of time, but how does that change throughout your experience while using it?
Yes, great. You usually don't need to start estrogen until much later in the game when it starts to fall in late perimenopause or into menopause. If you start having hot flashes and dryness, that can be an indicator that your progesterone is or that your estrogen is falling. So generally, starting with a little progesterone and increasing it with time is often where women start. Some women do great adding a little testosterone and or DHEA as well. These are androgens. They're associated with men, but they're very important for women as well. In fact, women actually have more testosterone than men at certain times of the month. So, and these do start to fall earlier in life. So the answer really is though that it depends on your unique hormones, how they shift and the experience, your symptoms you're experiencing.
Great, great. Thank you. Okay. And some other questions more related to like lifestyle. So, when is the best time to exercise, specifically lifting weights? Cool. What exercises in general are best for perimenopausal women? And then there's some more smaller questions in there, and I can come back to them, Dr. Mary. But there's also a question about intermittent fasting. Is it recommended, and does it interfere with exercise? So it seems like a functional kind of diet and exercise question there.
Beautiful. I love this question. Okay. There's two parts to this question. The first part is one of my favorite things to speak with women of all ages about, and it's has to do with something called cycles thinking. This is a truly life-changing concept that I wish we were taught. I wish I was taught as a prepubescent girl because it's so valuable. And the idea with cycle syncing is that you want to sync your habits with your hormones and what your body wants for you across the different phases of your menstrual cycle. So remember that diagram I showed you of the hormones corresponding to physical changes in your body? That means your body needs different things from you at those different times. So the four phases, the menstrual, follicular, ovulatory, and luteal phase, they happen in that order. You can get away with a lot more in the middle two phases, the follicular and the ovulatory, than you can in the menstrual and especially the luteal phase. That's the week before your period. During the other 2 weeks, you're more resilient, you have higher energy, sleep better. You generally just feel better, so you can fast more. You could exercise more and more intensely. You can eat less. This is a time if you want to lose weight that you can try to lose weight safely. You can be more social and you can shoulder more stress and just more on your plate in general. However, in your luteal phase and to some degree in your menstrual phase, the opposite is true. You're lower energy. You need more rest, more sleep. You're less social. You're more sensitive to everything and prone to inflammation from stuff like unhealthy food, alcohol, social stress, etc. So this is when you really want to dial things way down and be good to your mind and body. Otherwise, you'll have symptoms like PMS. So especially in that final week of your cycle, the luteal phase leading up to your period, no intense exercise, no fasting, no deprivation of any kind. Whether it's sleep or food or me time, you just need more of those things. Why? Because your body is actually doing something really miraculous. Women tend to get bummed out about this period, but I mean, for me, at least when I realized what my body was doing, I was like, oh, amazing. So in that time, in that week leading up to your period, the endometrial lining, the inner lining of your uterus, it thickens a lot to prepare for the possibility of pregnancy during this week. And that takes a ton of energy. It's like if you had a big wound or you needed to regrow a giant tissue, your body needs more rest and downtime. And you need to increase your caloric intake by 20%, right? Not the time to fast. And the reason you get cravings at this time of the month is that your body is asking for more because it needs it, and we need to listen to those cravings. You're not going to gain weight, unhealthy weight, by increasing your calories during that luteal phase. So you want to up your protein, healthy fats, complex carbs, so your body has the fuel it needs to build that new organ. And if you don't, you send your body into a stress state, and actually you'll end up with terrible cravings, wonky energy, bad mood, and probably actually gain weight due to stress hormones, even though you might be eating less. So anyway, You asked about the best times specifically to lift weights and fast. So the best times are during the follicular and ovulatory phases, roughly the 2 weeks following your bleed week. Right. Okay. So then there's a piece on intermittent fasting in there as well. Is it recommended for perimenopausal women? Absolutely. During the times I just mentioned. But there is one caveat, and this is the second piece to the answer to your overall question about lifestyle for women, especially in perimenopause. Please do not follow the advice for men when it comes to fasting and exercising. Again, that research, the research and all that stuff was done in men, and women need different things. Our bodies respond differently. So regarding fasting, you never want to fast like longer than 16 hours in general for women. Men, the standard is the 16-8 fast. It was all over the internet for a while. Oh, it's a little too long for us. It sends us into high cortisol, like stress mode, and we tend to gain a little more belly fat when we have that cortisol high. So that's one of the key things around losing belly fat. Reduce the stress, don't fast too long, all that kind of stuff. About 14 hours, 15 hours is what's recommended by most experts. 12 hours is what works for some women. It just really depends on your body, your activity level, your stress level. And you want to have your eating window earlier in the day. Don't fast all the way till noon and then eat dinner at 7 o'clock and finish at 8. This is bad news for your hormones, your mitochondria, your metabolism. You will gain weight that way. You want your fasting window to be earlier. So that's kind of the piece around fasting. I'm getting long in the tooth, but I'll just say something about the sport, the weight training, because there was another question about that. I'm realizing we are running out of time, but in terms of exercise for women, in perimenopause, it becomes so much more important to do strength training. So there were like basically 4 kinds of exercise. We got mobility, strength training, we got high intensity cardio, and more low intensity thing like aerobic exercise, like walking. So after we turn about 35 or 40, it becomes way more important to focus on strength, to dial down the high intensity cardio because it's not doing as much for you. You can still do some, but certainly it's not the best thing and it's not going to help you lose weight. And that debate about how much lower intensity exercise to get, but I think that the more walking, the better. Mobility is super important as well, especially as we get older. The strength piece is huge because we actually lose bone density and muscle mass during perimenopause more than at any other time in our lives, including menopause. Did you catch that? Perimenopause, we lose muscle and bone density rapidly. And then we kind of plateau. So we really need to counter that with strength training to build muscle or keep what you have and to preserve bone density. Because bone is a tissue that's always growing and remodeling our whole lives. It's not static. Most people don't know that. It's really responsive to our lifestyle. The more tension you put on your bones through strength training, the more the muscles pull on the bones as they contract, and the stronger and more resilient the bones get. So especially if you have low bone density or osteoporosis in your family, make sure you're weight training. And I don't mean like the 8 to 10 pound dumbbells. This is a huge mistake I see women making all the time. You want to lift heavy. Keep working to lift as heavy as you can, like 6 to 8 rep max. You won't get bulky. That's not how it works. And women say that to me all the time. I don't want to get bulky. It's actually really hard for women to bulk up. And most women are afraid of that. If you see a bulky woman, she's probably taking some exogenous thing to get her that way. Some women have a larger build, but you won't go beyond a point. Muscle will also help you burn away fat and increase your caloric burnout rest, and it'll improve everything about how you age. So muscle is actually hugely important when it comes to aging well, and there's a lot of research and great media on that right now. Like Andrew Huberman, Peter Attia, Rhonda Patrick, they're putting out lots of info on how muscle is really like the fountain of youth for so many reasons I won't go into here. But as I wrap up this question, I wanted to mention a book by Dr. Stacy Sims. She coined the term "women are not small men." She has lots of online resources on training, especially for women over 40. And there's a woman called Mindy Peltz who wrote a book on fasting for women, which I think is called Fast Like a Girl. So I'll leave that question there. Cool.
Awesome. Thanks, Dr. Mary. I'm going to quickly hand it over to Michelle. But Dr. Mary, thank you so much for your insights. And everybody, just hang on for like 2 or 3 more minutes to hear from our CEO here, and then we'll let you go. But we hope you've learned a lot, and we're so glad that you came. Thank you.
Thank you.
Thank you so much. That was amazing. So thank you for that. And Mary, every time I hear from you, I feel like so much of what I thought I knew about my health gets like unraveled and reshaped into a new, like much more grounded, real 24 narrative. So thanks for bringing us all up to speed.